Going to therapy for the first time can feel like showing up to a party where you don't know anyone and you're not even sure what the dress code is. It can feel weird, awkward, and maybe a little bit scary. I know for me, this is one of those emotions and feelings that I definitely felt when I first saw my therapist for the first time. I really did not know what to expect. I didn't know what to do. I didn't know how to kind of really appear or approach this concept of therapy. And I was in a very incredibly vulnerable state. And I think that's one of the things that we often don't think about, what happens in the first therapy session, especially if it's with your first therapist that you've ever seen before. My name is Dr. Phil Sarpon. I'm a clinical psychologist, and today we are going to talk about all things in terms of what the first therapy session actually looks like. This channel is dedicated to all things psychology, wellness, and graduate school. And so without further ado, let's go ahead and jump right into what to expect in your first therapy session. Now, I think one of the things that's really important is that usually when it comes to your first therapy session, maybe you hopefully already had a free consultation, 5-minute conversation, either over the phone or on video with a therapist, the therapist that you're choosing to potentially work with. And then in that stages before the first actual therapy session, usually most therapists are going to send you a lot of documentation, intake forms, consent forms, HIPAA compliance, virtual therapy, remote work compliance, and forms to sign before that first therapy session. The other thing is that they might send you some measures, and typically what measures are they're essentially just surveys to gauge whether or not you fit into a particular scale as it relates to anxiety or depression. For example, one scale is the PHQ-9, which typically assesses depressive behaviors and symptoms. Another one is the GAD-7, which typically assesses different things like anxiety. And these are self-reports. So you're reporting about how often you feel irritable or anxious or depressed and your mood. And what your therapist is going to do is that they're going to take those surveys and they're going to assess if you're reporting certain levels of anxiety or depression that are typically notable for the general population, or if it's higher typically than the average person would report. And if you are, then that there might be something to it in terms of how they are then going to help you to treat that depression or that anxiety. And so that information is really important for them to get a clear diagnosis of what is actually going on. Now, once you actually get into that first therapy session, typically what's going to happen is that it's just going to be a lot of conversations about your upbringing, your childhood, your medical background, your health history background, your family. Do you have siblings? How did you grow up? Did you have a good, healthy relationship with your parents or your caretakers or your caregivers? What life and occupation looks like for you? Did you struggle with any mental health growing up? Do you have any family history of mental health? Are there any genetic dispositions of mental health potentially in your family that you can see from your parents, your grandparents, or even your siblings? They're going to ask you about different problems and things that you want to focus on within the therapy sessions. That's going to guide them in terms of the focus of the interventions that they might apply for you as it relates to future therapy sessions. They're going to ask you about, again, your medical health history, your mental health history, as well as your social history, your occupation, as well as maybe some of the goals that you have for therapy. And one of the things that I think is really important is that in the first session, one of the things that the therapist should hopefully try and do is really just build a rapport with you. They should just try and get to know you. They should hopefully make things easy for you and communicate some of the guidelines of therapy. You should also understand that everything is confidential. All right. The only reason that the therapist would ever break confidential information, tell personal information to somebody else is if you become a danger to yourself or to somebody else. And that should definitely be communicated in that first therapy session. It should be also understood that at any point in time, you can stop therapy. You can essentially fire your therapist if you feel like you're not getting out what you need or what you put into it. I think one of the best things and the best signs to understand when you may not be working with a good therapist is if you've been working with them for quite some time and things have not gotten better. Now, here's the thing. Typically, when you start therapy, things actually will often get worse. So for example, with PTSD, whenever patients start PTSD treatment, their nightmares will get worse. Their symptoms, irritability, depression, anxious symptoms will actually get worse before it gets better. That's often the case because whenever we are going to therapy sessions, we're now actually encountering the problem head on. For most people, when it comes to mental health, they're avoiding it. they're numbing it with substance use and other behaviors that can kind of cloud and numb the effects of the mental health. They are either avoiding it with being working overtime or being so busy that they don't have the time to think about their mental health. And so when you actually take the time to engage in your mental health, oftentimes the symptoms get worse before they get better. But if you've been with a therapist for weeks and months and even years and you don't feel like you've gotten better, then I would strongly recommend that maybe you fire your therapist and look for a different perspective. Honestly, when it comes to therapy, the best fit is going to be the best thing for you as it comes to therapy outcomes. So if you like your therapist, chances are you're going to get some really good outcomes and get really good things out of therapy just because of the fact that you like your therapist. Now, the thing about therapy is that it's not magical. You know, some of the things that the therapist says aren't going to be necessarily fully revealing or insightful or like spiritually inspiring or motivating. Oftentimes what therapists do is that based on the things that you say, they ask questions to gather more insight from yourself. And what I tell people about therapy is that therapy is often a very active process. It's not like taking medication where you take the drug and then, you just wait for it to work. Therapy is a lot of work. It's going in prepared. It's going in to answer questions. It's going in to be contemplative and thoughtful about your answers. It's going in understanding that there might be some homework that you might have to do after the therapy sessions. It's going in, the more you go in with the active mindset, the more you put in, the more you get out. And I always tell clients and patients this, like therapy is, you really get out what you put in. And so if you put in a lot of time and energy into understanding yourself and doing the practices and doing the homework and getting there on time and engaging yourself throughout the process, you probably will get something out of it. In fact, almost 85% of people that go into therapy report positive outcomes. In other words, they say that they actually got better for most people. And so I think that's important to note, that the quality of the outcomes that you're looking for often is dependent on how active you are in the process. It's not a passive process. It very much so is an active process. And that means that the responsibility is not all on just the therapist to fix you and to have a magic pill for you. A lot of the process comes down to you and the work that you're willing to put in for yourself. Some sessions might feel emotional. Some might feel more like a conversation. Some sessions may be better than other sessions. The concept and the process is really that you're putting in the work through the process, and you're not just looking for the end result, but you're finding some of that motivation and some of that willingness to engage in the work even during the process. Again, be honest about what you want out of therapy. The more vulnerable and open you are, the more that the therapist has to work with. If the therapy relationship isn't working out with the therapist, feel free to try other therapists. Don't expect to fix everything at once. Oftentimes therapy is a process, and typically people who report the best outcomes are people who have gone through 16, 20, 24, over 30 sessions throughout the course of the year on a weekly basis. Your therapist is there to guide you. They are there to facilitate the conversations. They're not there to judge you. They're not there to tell you what to do. They're to simply ask you the questions that maybe you have been avoiding asking yourself for quite some time, and give you a framework in terms of how to deal with life and life's own terms. If you found this to be helpful, please like and share this video, subscribe to the channel if you already haven't, and hopefully I will see you all in the next video.